tuning into breaking news right now. Governor Charlie Baker speaking about the coronavirus response. Let's listen.
Assistance. On testing yesterday, the Commonwealth processed 11,118 tests. We had 1,963 confirmed positive tests of COVID-19, which means about 17.7% of the tests conducted were positive. This positive percentage is an important piece of the data that we monitor, and that latest number of 17% is down from a previous high that was much closer to 30%, which is a good sign because we test a lot more than we did a few weeks ago, and we've also tried to test in places where we were particularly concerned about the potential of community and organizational spread. As I've mentioned, we continue to hold daily calls with leaders in the healthcare community and have been closely monitoring hospital capacity and hospitalization rates related to COVID-19 and other non-COVID related issues throughout the state. As of yesterday, there were 3,856 patients hospitalized in Massachusetts for COVID-19, which is quite consistent with our data of the past few days, meaning that hospitalization rates for COVID-19 have been pretty flat now for about 15 days in a row. The percentage of all cases that are hospitalized has also been pretty consistent. It's at around 6%. While we're watching for that downward trend that many people talk about, not just here, but in many other places with respect to monitoring and measuring the spread of the disease, the number of people needing hospital care here in the Commonwealth has stayed pretty consistent, as I said, for the better part of the past 2 weeks. Flip side of that was we haven't seen an increase for about 2 weeks as well, which is also a good thing. We also suffered yesterday, I think many people know, the largest single day increase of COVID-19 related deaths here in Massachusetts, losing 252 people to this insidious virus. We obviously track a lot of numbers to understand the presence and the trajectory of this pandemic, but the lives lost every day is one of those numbers that none of us is ever going to get particularly comfortable with. Behind those numbers, as I've said before, are people and families and lives that have been forever changed by the lethal grip of COVID-19, and our hearts go out to everyone who's lost someone to this terrible virus. Finally, we continue to chase every avenue that's available to us with respect to PPE for healthcare workers and frontline workers. As of yesterday, we've delivered over 7 million pieces, including masks, gowns, and ventilators. With respect to contact tracing, I think most people know that earlier this month we announced the creation of a COVID-19 Community Tracing Collaborative in collaboration with the folks at Partners in Health to mitigate the spread of the disease and to contain it here in Massachusetts. We're the first state in the nation to launch this sort of a program, and we're fortunate to have a partner in this like Partners in Health on board, an organization that has done this issue fighting diseases and outbreaks in many developing countries and has battled Ebola and Zika and many other contagions in many parts of the world. And they have proven time and time again that their model can work, and in many cases in places that are far more challenging than they would be here in Massachusetts. We believe this tracing program is a key element toward not only stopping the spread, but also understanding where the virus is, who's been affected, and how we can go about making sure that we contain it. We launched this program earlier this month and said that by the end of April, we anticipated we would have about 1,000 people on board working on this particular initiative. That is just about the number of people we have working so far. And to have stood up an organization in that period of time on a joint basis with Partners in Health was a terrific piece of work, but now obviously the really tough stuff begins, which is making sure we do all the stuff we need to do and that they need to do to both identify people who test positive, support them in isolation, make sure we connect to their close contacts, and do what we can to support them as well. This team is now supported, by the way, by 80 local boards of health who have stepped up to work alongside and to help the initiative. And to date, this team, in a fairly short period of time where they've been hiring and setting up their call center operations, has made contact with about 5,000 people who are either COVID-19 positive or suspected to be close contacts of people who were. Tracing, as we've said before, is all about identifying and reaching out to the people that someone with COVID-19 has been in contact with. Our tracers can then tell those folks to monitor for symptoms and to self-isolate to prevent any further spread. Infectious disease specialists now believe this virus can go undetected for days, and some people who test positive actually never show any symptoms at all. Originally, when we first started putting this together, we projected that a person would have around 10 contacts that would then need to be contacted. So far, the average number of contacts is actually only 2. That's a very good sign because it means that the work all of you and we have done here in Massachusetts to stay home, to separate, to socially distance, and to take seriously this idea that all of us have a role to play in reducing the spread has made a big difference. And if you check out the mobility data that's popped up by Google and others with respect to how much people have been moving around since the sort of middle to end of March, the Massachusetts numbers track as well as any other region of the country. And that, again, is a good sign because it means the stuff that we've put in place, the work that you have done to socially distance, limit your travel, and limit the number of people you've come in contact with has had exactly the kind of impact on the rate of spread and the rate of growth in the disease here in Massachusetts that we hoped it would. With respect to this collaborative, if you receive a call from the collaborative, please take the call and provide the relevant information to the caller. What's been interesting about this from the beginning is as people have started calling folks who tested positive for COVID, the conversations have not just been about their close contacts. The conversations have been about what are the sorts of things that they and we need to do to help them isolate and to support them as they go through the process of dealing with the fact that they've tested positive and may or may not have already started to show symptoms. And that outreach that we make to them, which is then followed by outreach to their close contacts, is in many respects about providing them with guidance and support. And the calls have actually lasted longer than people originally anticipated they would, because folks who are in this situation had a lot on their mind and really appreciated the chance to have a chance to talk to somebody about what their concerns were, what their questions were, and how those concerns and questions could be addressed by the Commonwealth and by the folks at Partners in Health. The phone calls that you would get, if you were to get one, would come from an 833 or an 857 number, and your phone, if you have caller ID, would say MA COVID team. And the other reason why it would be important for you to take this call is it does mean somebody you've been in close contact with has tested positive, and we think it's really important for you to know what that means for you and how we can help you make sure that you aren't then somebody who ends up spreading the virus to somebody else. If you see MA COVID team come up on your phone, please pick it up. It's good for you, it's good for whoever it was that recommended we called you, and it's going to be good for the people that you're in contact with on a regular basis as well. This is, frankly, your chance to be part of the fight to both contain and push back against the spread and the virus. With respect to reopening, which is certainly something that I think is at the forefront of everybody's mind, including ours, the advisory board, led by Lieutenant Governor Polito and Secretary Keneally, has hit the ground running and has begun meeting with various employers, business organizations, and municipalities to talk to them about what some of their issues are and how they see this potentially working for them. Their goal, obviously, is to hear from employers from across the Commonwealth, from trade unions, from frontline workers, and from others to gather as much data as they possibly can and to work with the folks at the Department of Public Health and in the healthcare community to make sure that we can offer up specific guidance to those who would like to find a way to reopen, and then to hear from them about how that guidance might translate into what their day-to-day would look like on the ground inside their organization. The goal here is to try to make sure that as many voices as possible can be heard. They're setting up feedback and listening sessions across the state And as of Wednesday, they've talked to retailers, folks in the biotech industry, folks in the healthcare industry, folks in the technology industry, and obviously those brick and mortar retailers in particular have been very hard hit, and they are of particular interest, not surprisingly, to a lot of our colleagues in municipal government, because they do in many cases make up a lot of the Main Street activity that vibrant downtowns here in Massachusetts are all about. And this work is obviously going to be critical to our ability to make sure that a smart and planned phased reopening can take place here in Massachusetts. And we're glad that so many people are already stepping up, reaching out. But I'm looking forward to having an opportunity to present both short-term and medium and final report findings from the group as they move forward. We obviously appreciate the support and the guidance we've gotten from FEMA over the course of the past several weeks, and look forward to them reviewing our latest request. Let me just close by saying this. I think we all know tomorrow's May 1st, and it's a slightly different kind of May 1st than the one we've had typically over the course of the past few years. April, obviously, was a very long and very hard month, followed by or preceded by the month of March, which many people felt the same way about. I think what I would say to everybody is, while these are challenging and difficult times, we have in fact bent the curve. We did in fact reduce the spread. We are now living with a plateau that I'm sure all of us would like to see dip a little bit so that we can move a little more quickly with respect to what a reopening strategy would look like. But we've now got a smart group of people who are getting together literally for hours on hours every single day to talk to their colleagues here in Massachusetts about what smart policies and procedures would look like with respect to that. And we're obviously looking forward to having a chance to discuss those options and opportunities with all of you at some point down the road. We do continue to talk on a regular basis with our colleagues around the Northeast region. Many of them are wrestling with the same kinds of questions and issues that we are here in Massachusetts. In some respects, those conversations are reassuring because it's pretty clear that they're thinking about and talking about a lot of the same things we are. But I think all of us understand and appreciate the fact that the best way to handle the reopening on this is to make sure we do it in a way that's consistent with the data and the recommendations that have come from virtually every level of government and every country with respect to when it's appropriate to reopen, to make sure that we reopen when the time is right. We do it in a way that is safe and will be successful, and that we don't create a scenario in which this virus comes back at some point down the road.